Hi everyone, my name is Dr. Kate Wang. I'm a senior lecturer in pharmacy from RMIT University. I have previously worked in both hospital and community pharmacy. I've had about 10 years of experience working as a pharmacist. I'm also a researcher in aged care and pharmacy practice. Currently, we have an aging population in Australia. By about 2060, we have a projected 21 to 23% of our population will be 65 or older. And with that comes with many challenges. For example, older people are more likely to be on multiple medications, therefore they would need care and medication management that is on a regular basis, and that's where pharmacists can come in play as the medication experts. In addition, older people are more likely to have multiple chronic conditions, so long-term conditions such as heart conditions, diabetes or cholesterol conditions, and that requires long-term care. Pharmacists are the most accessible healthcare professionals in Australia, and because of that, we see a lot of our patients on a regular basis. They come into the pharmacy to, buy not only medications, but for example, they can come here to buy sanitary needs or things for over the counter, things that they want to eat as well. So we see our patients quite regularly, and that sort of puts us different to other health professionals, is that we do have that regular contact with our patients. And from that, what we can do is, because we're able to see them regularly, we are able to provide more of a regular monitoring and regular health management for our patients. And that's what expanding our scope of practice means, is so that our patients are able to get access to timely care. And as a result of that, we are trialing and piloting a lot of structured prescribing, which is when pharmacists are able to prescribe under very restricted or certain guidelines and protocols. And things that we're trialing for example, in many states are uncomplicated urinary tract infections, oral contraceptives, as well as travel medications and minor skin conditions. And all of these conditions require timely access. For example, urinary tract infections, if left for too long, can develop into very serious infections. And because we have that regular contact and it's so accessible for our patients, that's why this is so important. PSA 24, which is run by the Pharmaceutical Society of Australia, also known as PSA, was held in Sydney this year, and I was very fortunate to attend that. And it was really great to have all of these healthcare professionals, and particularly pharmacists, come together to talk about changes in scope of practice. Changing in scope of practice is a huge task. There's a lot of work behind the scenes. For example, people have to review the regulations, people have to, think about the logistics, we have to pilot the changes to see how it's going, get that feedback before it gets rolled out bit by bit, each state by each state. So there is a lot of work behind the scenes, and I think we're very excited to have that. And as a healthcare professional's point of view, putting the patient first is what we're really passionate about, and that's really the whole key of our work. And knowing that patients are able to access that timely, safe care is a great feel for all of us. And I think we're also very keen to work in a multidisciplinary approach, to collaborate with other healthcare professionals in order to see that through. Being a pharmacist is both stressful but also very rewarding. As I think any health professional, the landscape is always changing. I think we need to be really ready to adapt to change, and that's really important. We need to adapt to new treatments, new medications that's coming out, as well as being ready to combat new potential viruses or other diseases. So being a pharmacist in this day and age, I think we need to be ready for change, but at the same time, knowing that we're able to make a difference, whether it's to one person or it's a population of people, I think that's really important.